Guys, welcome to Subu Medicine, and this is nephrology. Okay, so today we'll be discussing about the micturations. Okay, that's what we'll be focusing on. So here, if you see the structures down here, okay, like this is gonna be your kidney right here. All right, so this is gonna be your kidney right here, and this structure right here in the pink, this is gonna be a ureter. Okay, and this one right here, this is gonna be a bladder right here. Okay, and this is going to be your urethra, and we'll be discussing about this today. Okay, so now, let's quickly label this. Okay, so this is going to be your kidney, right, as you guys know this, right, and this is going to be your ureter. That's what it is. Okay, because whenever we talk about the micturations, we need to discuss about the anatomy. Okay, so let's talk about that first. So this is going to be ureter, okay? And then what happens is that when this ureter, remember, they're from the calyces, okay? The ureter, which breaks down to calyces, right? That's what is going to happen. From there, the calyces, okay? The ureter is this one. This is bringing the urine from the kidney and draining into the urinary bladder, okay? This structure is my urinary bladder. And remember, this ureter is about like, it's about like a 20 to like a 30 centimeters long, okay? That's what it is. And this ureter also is the smooth muscle cells, okay? Smooth muscle cells. And we'll talk about the importance of the smooth muscle cells too, okay? And what happens as it's passing, see how it does not actually drain into right on top here, okay? This is going to be your adventure and the raid, okay? What happens as it's passing, it kind of like penetrates the urinary bladder and passes obliquely, okay? It passes obliquely and then it opens at this two area, okay? And this two area, this opening, we call, a special name is given for this one, okay? This is called, because it's opening, there's a two opening which are called ureteral opening, okay? That's what it is. Now, and look, the way it's moving is, the way these guys are moving, it's more moving in a inferior, okay, medial direction. That's what it is, opening, okay? And these are two openings. This is where the urine will come out here, right? And then you see this structure, the triangular, okay? Whenever we make the structures, okay, this structure right here, this is called, which is inside your bladder, this is called your trigone, or you can call them, this is called trigone vesicae, okay? But I'll just write on trigone for our case, okay? And this area right here, which is called the central of the trigone, okay? And this opening, you see right here, the triangular shape is called trigone. This opening right here is because this is opening into what? Urethra, okay? So we call them it's a urethral openings, okay? Or you can call orifices too. And this right here, this structure right here, this structure is here. This is going to be my this is going to be urethral, okay? That's what it is, all right? Now, we have to talk a little bit about this histology of this urinary bladder, okay? Remember, this urinary bladder consists of a couple of things, and we'll have to talk about this. One of the things that it consists of is, okay, look, we have to go the inner layer, okay? Inside this, you see the black ridges, okay? These black ridges are called rugae, okay? These are called rugae. And there's importance of rugae because whenever this urinary bladder is empty, okay, there's no urine is there, what happens? You see these rugae. But as the urinary fills here, what happens? It gets stretched, okay? So the rugae disappears, all right? So it kind of gives a space, all right? That's what it does, this rugae. And this, whenever we talk about the histology, there are a couple of things we have to talk about. One of the things we have to talk about right here is that the inside the layer, okay, we call them mucosa, okay? The innermost layer, we call the mucosa, okay? And the innermost layer of the mucosa, it consists of, very, very important, it consists of transitional epithelium, okay? We call them a transition. And what does transitional epithelium means? Okay, look, let's just make this as, all right? It's a stratified transitional epithelium. And then we'll make this as like a dome shaped right here, okay? Look. So, if you look at this right here, okay, this is called transitional epithelium, or another name for this is called urothelium, okay? It's called transitional epithelium, all right? or urethra, or it's also called urothelium. Okay, so now this transitional urothelium itself has three different parts. Okay, it is divided into three parts. This upper layer we call them as, okay, this is called superficial layer. It's called superficial layer. Okay, and then the reason why it's called superficial layer is because on top of this, there's a cell located here, okay, which are called umbrella cell. Okay, they appear to be umbrella-like structures, and they are binucleated cells. All right, this umbrella cell, and this layers of cells, which is an intermediate layer of cells, okay, we call them intermediate layer cells, and these cells are connected by desmosomes. All right, and this layer right here, last one that is actually sitting on those, let's say, basement membrane, which we call them a basal cell, okay, or the basal layer of the cells. Because the reason why I'm mentioning is this because, okay, guys, you see this layer on top of, which is umbrella type of appearance, okay, which are called the umbrella cells. This is really, really important, all right? And these are connected by tight junctions, okay? So that's the reason why these guys are very, very important for maintaining something called this urothelium, okay, permeability barrier, okay? That's what it does. And these intermediate layers are connected to each other by your gap junctions. Sorry, not by gaps, it's by desmosomes, right? And this basal layer, this basal layer, they have the stem cells, okay? Stem cells for urothelium, okay? The transitional epithelium. One more thing that's very, very important here is that this urothelium, you know what they do? They secrete, very, very important, glycoaminoglycans, okay? And the reason why it's really important that they synthesize these glycoaminoglycans or secretes glycoaminoglycans is because this prevents from, okay, this prevents from any sort of like microbial growth, okay, and it prevents from, let's just write down, prevents from your bacterial growth, okay. So basically what it's doing is that it is preventing for the urinary tract infections, okay, that's what it does. And remember, we'll talk about in a female, you know, this urethra is shorter. It's about like 4 centimeters long, okay? And then in male, it's about like 20 centimeters long, okay? So it's more common for female to get urinary tract infection because bacteria can easily go and get inside there. But remember this, that these glycoaminoglycans that is secreted by the urothelium is very, very important for actually, you know, preventing any sort of like bacterial growth there, all right? And remember, I just going to talk about the permeability barrier, okay? That permeability barrier, the role of this permeability barrier that maintained by urothelium is, what does it does is that it does not allow any sort of like, remember, because urine is coming down here, right? And urine consists of like a lot of them. What is the compositions of urine? Remember, it has like 95 to 96% is water, okay? And then it has those urea, okay, uric acid, a little bit of that. It has a sodium, chloride, bicarb, right? It's all the protons. And then it has those nitric acid, all of those it has, right? So what happens? It does not allow the urine, okay, these guys to sort of like get exchanged with the muscular wall of the urinary bladder, okay, because of this permeability barrier, all right? Now, after this, okay, these cells, as I said, this is a transitional epithelium. The reason why we call them a transitional epithelium is because, look guys, what happens is that, you know, when this bladder is not filled, okay, what happens is that these cells appear to be transitional, okay? This cell appears to look like this. But as soon as, let's say, let's look at this. As this cell, what happens? As the urine is started accumulating down here, okay? And what happens is that, you know, it causes stretch on these cells, okay? And when this causes stretch on cells, what happens is that these guys, okay? Remember, there's lots of layers out there, right? This layer, sort of like these cells, kind of like this umbrella cells, okay, they kind of convert into squamous, okay? So what happens? They become like flat cells right there, okay? So because of that, what happens? There is a reduce on the layers as they get stretched, okay? That means what happens? These cells have a transition properties, meaning that these cells have a changing properties, okay? That's the reason why we call them a transitional epithelium, okay? Now, not only this, let's say, this guy's urinary bladder has transitional epithelium. Even this ureter, okay, this ureter also consists of like your transitional epithelium, okay? That's what it is. Now, And these are just a muscular tube, right? This muscular ducts, which is actually connecting or bringing the urine from your kidney to the urinary bladder, right? Now this is the innermost layer, which is the transitional epithelium, right? They also have those lamina propria, right? They have non-elastic connective tissue there. And then you have the muscularis part, which is this guy. You guys see this? Okay, this is very, very important. This guy right here, this in the blue structure, this is a muscularis layer, and we'll just write it down here. Okay, this is very important. This muscularis layer is known as called detrusor muscles. Okay, and there's the importance of detrusor muscle. And this detrusor muscles itself is divided into 3 different parts because it has like this. It has a first inner longitudinal layer. Okay, let's write it down. So it has inner longitudinal layer. Okay, and then it has, now let's just make this, it has other one in middle like this circular layer like this. Okay, and then there's also another layer which is a outer longitudinal layer. Okay, so these detrusor muscles are composed of these 3 different types of layers of the cells: inner longitudinal layer, and then you have a circular in the middle, and also you have an outer longitudinal layer. Okay, this is detrusor muscle. This is very, very important. And these are what? These are smooth muscle cells. Okay, these are smooth muscle cells. Okay, now then after that, this red right here, this red is going to be your adventure. Okay, all right. Now that's a little bit of histology. Okay, that I wanted to quickly touch on that. Now after this, we just talked about this is also like this tube, which is a ureter, which is also transitional epithelium, right? But now, before even we go over there, okay, we have to talk about this guy. This is right here. This is urethra right here, right? So here, you see this right here? In this light blue color, what is this? Okay, these are called, okay, internal urethral sphincter. Okay, and this is involuntary. Okay, we'll talk about that means too. And then if you come back down here, look at this, guys. Okay, these are called external urethral. It's a urethral sphincter. Okay, and the reason why is because remember, what happens is that as this urethra, okay, it penetrates through something called urogenital diaphragm. Okay. So it sort of like penetrates to the urogenital diaphragms, and there is a striated portions, okay, that sort of forms this external urethral sphincter, okay, and this external urethral sphincter, it is a striated muscles, and it is in a voluntary control. It's really important that you remember that, okay, it is in the voluntary control. Now, okay, now that I have to quickly talk about the difference between female and male, okay? So if you look at this structure, okay, let's use this as structures. Let's use this and this one, okay? Think about this as a male, and think about this as a female, okay? So what happens is that, right down here, this structure right here, okay, there is a prostate gland right here, okay? When it comes about male, okay, that's what it is, right? And this is internal sphincter. And this below the prostate gland, you're going to see the external sphincter, okay? That's what you get to see. And this urethra, okay, it is about like a 20 to 20 centimeter long when it comes to a male, okay? So whenever a male, it's about like a 20 centimeters long, okay? But when it comes to female, if you see this structure right here, okay, what happens is that this structure right here, this is like about 4 centimeter long, okay? Only 4 centimeter long. And this urinary bladder also, it is usually smaller compared to the male. The reason why the bladder is also smaller is because, remember, the female have what? The female also have uterus, right? It's because of that, okay? It's because of that, usually this bladder is smaller compared to the male, okay? And also this urethra is smaller, about 4 centimeter long. That is the reason why females are more susceptible for urinary tract infections, okay? Because the bacteria can easily get up down here, okay? And also one more thing, usually this internal urethral sphincter is usually not anatomically present in female, but it's present in male, okay? And also one of the difference between the male and female is in the male, this urethra is very, very important for actually carrying urine plus semen, okay? So it carries not only that, it carries, let's write down, semen, okay, and then also urine, all right? But in female, usually it's only for female is usually only for urine, okay? Now, that's a little difference between male and female, okay? So, now let's talk about the little bit of the anatomy of it too, okay? Quickly touch on that. You know, guys, like right here, this urinary bladder, okay, they're supplied by internal iliac arteries, right? Internal iliac artery gives two branches, okay, which are called, let me write down here, which are called superior, okay, superior vesical arteries, okay, and this gives branch and it supplies to this anterior part right here, okay. This goes and gives supply to the anterior and the superior of the urinary bladder, okay. But there's also one more artery that is given by, okay, internal iliac, which is called inferior, okay, what should I write down? It's called inferior, let's write down, inferior vesical arteries, okay, and that is supplying the fundus down here, okay, and the neck of this bladder, all right. Now remember one more thing, guys. This inferior vesical arteries, this is present in male, okay, but in female, this inferior vesicles, okay, we do not call them inferior vesicle. It is replaced by vaginal artery, okay. It's called vaginal artery, and this vaginal artery right here, okay, this supplies the posterior and the inferior part of this fundus of this urinary bladder, okay. Again, let me repeat this. In both this superior vesical arteries and inferior vesical arteries, it is coming from internal iliac arteries, right? And the superior vesical artery right here, okay, that is supplying the superior and anterior part, right? And in both in male and female. But in female, okay, this inferior vesical artery is not present. Instead of inferior vesical artery, they call that as a vaginal artery, which is supplying the posterior and the more inferior part of your bladder, okay? And remember, also one more thing that I have to quickly talk about is the drainage systems of that is going to, these guys are going to drain into what? Internal iliac veins, right? That is the drainage systems of this. And also one more thing, let's just quickly talk about this too. You know, if there's a drainage systems, there has to be lymph nodes as well. And it's really important that you understand the lymph nodes too, because the superior part, okay, the superior part that drains into, okay, external iliac nodes, okay. I'm just gonna write it down. Let's write down here. External iliac nodes, okay. And the inferior part that sort of like drains into internal, okay, iliac nodes, okay. That is when it comes to lymph nodes, okay. So again, superior part which drain into the external iliac nodes and the inferior that drain into the internal iliac nodes, okay. Now, after this, okay, now let's discuss about the physiology aspect of the micturations, okay. Now what do we have to talk about here? You see this kidney right here, okay. The kidney, how does the kidney propel the urine, okay, to the urinary bladder, okay? So that's what we're talking about. The way it works is that, okay, there's this calyces right here, okay? This calyx, we call them like a calyx, right? And this, what happens is that the calyx has those pacemaker properties, okay? So what do they have? They have the pacemaker properties. What it does that it causes it induces a wave of depolarization. That is what it does, okay? Now, and the way it does is that whenever it has a pacemaker activity and it causes a wave of depolarization, right? So when the depolarization hits, what is going to happen is that that's going to cause this ureter to go through something called, okay, let's write down here, peristaltic contractile wave, okay? That's what is going to happen. So peristaltic contraction will take place, okay? And this peristaltic contraction wave, what is that? That is going to propel, okay? That is going to propel urine through this ureter from this kidney to the bladder, okay? Let me repeat one more time. So whenever there's a depolarization occurring, okay? And also one more thing. There are also like parasympathetic, sympathetic supplies are there, because remember this ureter is a muscular tube. It contains a lot of those smooth muscle cells, right? So because of what is going to happen is that whenever there's a wave of depolarizations occurs, okay, and there is a stimulations of, okay, let's say the your parasympathetic, which causes the peristaltic, which enhances the peristaltic contraction property here, okay? And also remember, gravity also plays a role here, all right? So what is going to happen is that whenever this peristaltic contraction is occurring here, okay, that causes, okay, stimulations of this ureter, and then that cause the urine to move through this ureter, okay, from the kidney to the bladder, okay? And this is a process of the peristaltic wave of contractions. And the way the peristaltic works is that, okay, it's initiate, okay, it's like about like, let's say 2 to 6 centimeter per second, okay? That's what it is happening. So it's continuously what is happening. Kidney is filtering, and then this ureter is bringing the urine, and what is happening is infilling this urinary bladder. That's what it is doing, okay? That's what it is. And this opening area, the three opening area, ureteral opening, okay, the 1, 2, and this is, remember, this is, what is this called? This is called your urethral orifices, okay? That's what it is happening here. Now, as we discussed, now this is what's going to happen here, right? And remember, guys, this urinary bladder, varies from person to person, but they have the capacity to hold about 600 to 800 ml of urine, okay? That is a lot of urine, all right? Because this is okay, more than that, that's going to tear this, okay? Tear these muscles, okay? The wall of this bladder, right?